Okay, thank you so much for that introduction and for the opportunity to be here tonight to talk about this topic with all of you. So I do have a couple of disclosures that I'd like to start with. First, I'd like to disclose that my research is funded by these sources and that I am listed as an inventor on patents related to these discoveries. These relationships are reviewed and managed by the university annually in accordance with its conflict of interest policies. I'd also like to disclose that I will be discussing some diagnostic tests that are either in current use or that are being developed for use in veterinary patients, and none of these fall under regulatory scrutiny in the United States. Therefore, the use of these tests is really up to the due diligence of the veterinarians that are using the test and also the families that are using the test for their pets. A couple more disclosures. The goal of my presentation today is to inform about these tests that are available and to discuss their rational use in general, but it's not intended to either endorse or discourage the use of any particular test. And I also want to mention that I'm not an oncologist. My clinical specialty, as Will said, is in small animal internal medicine, but I do oncology research. So I'd like to start by just going over what I hope that you leave this conversation with today. Essentially, my take-home messages. Liquid biopsies, even though this is kind of a hot topic and a buzzword, it's really an evolutionary step in medicine. Even though the goal is to develop a test that can help diagnose cancers early, these tests are not ready for their indiscriminate use in all patients. And we, as veterinarians or owners, need to interpret the data carefully to ensure that we are both using these tests appropriately and interpreting their results appropriately. And then finally, I'm going to say this many times tonight, a liquid biopsy test, just like any other diagnostic test that we do, should be actionable, meaning the results of that test should affect how we proceed with the care of that pet. So starting with a roadmap of what I'll cover today, I'm going to start with a brief background of liquid biopsies. I'll then go into what I consider to be some important considerations with the use of liquid biopsies in veterinary medicine. I'll cover some applications of the use of liquid biopsies. And then I'll briefly discuss some of the liquid biopsy tests that are either currently or recently in use in veterinary medicine. I'll discuss some ongoing work in this field that is happening at the University of Minnesota Veterinary School. And then I'll end with some final thoughts. So starting with a brief background. What is a liquid biopsy? So this is a term that's really just kind of coming to common use within the past several years. And the term liquid biopsy really refers to a non-invasive blood test that is used to provide important information about somewhere else in the body. And the term is often used to refer to cancer diagnostics, but this concept is not exclusive to use in the cancer realm. So when we use the term liquid biopsy in the cancer diagnostic sense, what we're referring to is we have some tumor present in some organ in the body, but what we're doing is sampling the bloodstream, and then we are analyzing the blood sample to find different features within that sample that can be used to predict or determine the presence of cancer in that distant organ. And as I mentioned, liquid biopsies are not just for cancer detection. They do have other potential uses, and even something as similar as simple as the serum biochemistry profile. This is one of our most common tests that we do. It's done all the time, and it has features that help tell us about kidney function and liver function. We can use samples to look at endocrine diseases. This really could be considered a liquid biopsy test in and of itself. But a lot of times when we use the term liquid biopsy, we are using it in the sense of cancer diagnosis. And that will be what the majority of my talk focuses on today because that's where my research lies. So liquid biopsies offer a lot of promise, and when used appropriately, they can be extremely useful because of several advantages that they have over tissue biopsies. So of course they are non-invasive. We're talking about obtaining a blood sample. So it's not anything that's terribly invasive. It does tend to be less expensive than doing a surgical procedure and getting a sample of tissue for biopsy. And a liquid biopsy can be used to detect material from far away tumor sites. And so this can be something that can be very useful when obtaining an actual sample of the tumor can be either challenging or very invasive, such as a tumor in the chest cavity or a brain tumor. So these advantages make them very promising for their use in both human and veterinary medicine. However, there are some disadvantages that should be noted. The assays for liquid biopsies can be technically challenging, meaning not every laboratory will have the capability of doing every liquid biopsy test. There are some other concerns with reproducibility. And when I refer to reproducibility, that means if you have one blood sample and you divide it and send it to two different laboratories, or even within the same laboratory, if two individuals are performing the test, do we get the same result between those two individuals? Um, Third, tumors can shed the material that's used for liquid biopsies inconsistently. So a sample from one patient one day may look quite different from the same sample from the same patient a couple of days later. And that's potentially due to these tumors shedding this biological material at different rates. And then finally, they can be expensive. So I did say that they are usually less expensive than doing a surgical procedure, but as far as blood tests go, they can be relatively expensive. However, despite these disadvantages, the advantages and particular the non-invasiveness of them do make them quite appealing. As I mentioned, this term liquid biopsy has really just kind of popped up in the last few years, but the concept of liquid biopsies really has a long history in diagnostic medicine. So this timeline here shows different milestones in liquid biopsy development in human medicine. And as you can see, the use of circulating tumor cells and their identification in the blood has been described as far back as the 1800s. So the concepts are not new. However, over the past few years, there really has been kind of an explosion in the science that's been used to develop these liquid biopsy tools. And this figure was in a paper published in 2020, and even since then, there have been a lot of new developments in this technology. There are multiple different things, analytes that can be used in liquid biopsy tests. So I'll start at the circulating tumor cells here at around 11 o'clock and go clockwise. And these are just a few of the different things that can be measured and used in a liquid biopsy test for cancer detection. So the tumor can actually release tumor cells, and these cells can be identified in the blood. We call these circulating tumor cells, and they can be used for both diagnosis and for monitoring therapy. The tumor cells can also release these little packages that contain information about the tumor. We call those extracellular vesicles, and they are small little packages that contain important information like DNA and proteins. We can also see just free-floating DNA that originates from the tumor in the bloodstream, and that can be measured both in a quantitative sense and also looking at what types of tumor DNA are present and used in liquid biopsy tests. We can also see what's called epigenetic modifications. So these are changes that are done to the DNA after it's translated. And so these patterns can be used to determine information about the tumor. We can look at different proteins that can tell us information about the tumor. And then the final one on this chart is tumor educated platelets. These are blood cells that have actually been changed by the tumor, and then their kind of behavior can be used to determine information about the tumor. So all of these analytes can be used for liquid biopsy tests, and certain tests may use any particular one, or sometimes even combinations of these analytes in the development of their diagnostic test. I'm now going to move on to some considerations that I think are important to keep in mind when considering the use of liquid biopsies. Liquid biopsies should be used judiciously, and we're not yet at the point where we can use them indiscriminately in all patients. As I said, there's very little to no regulatory oversight of these tests in veterinary medicine. So it's really up to the veterinarian and to the family to interpret the data carefully. In doing so, we need to be aware of confounding variables, and I'll talk about some confounding variables that can come into play in the next couple of slides. We need to consider transparency and reproducibility. I already mentioned reproducibility. So one sample from a patient analyzed by two different labs or two different individuals, does it result in the same answer? Transparency refers to how many of these tests that are being marketed are proprietary. And so the user does not necessarily know what exactly is being measured or how the results being determined because that information is sometimes withheld by the company. And then finally, as I said, I'll be mentioning this one a lot. The results of a liquid biopsy test should be actionable. And what exactly that means can be different for every individual or every family. But anytime we do a test, we should be doing that test because it's going to affect the outcome for that patient. As I mentioned, we need to be aware of some confounding variables because they can cloud interpretation. And I'll mention a couple here, so age and size. Focusing on osteosarcoma because that's where the majority of my research lies, I'm showing here a graph of the age at osteosarcoma diagnosis. And this graph has both humans that are diagnosed with osteosarcoma and dogs. And just explaining kind of the layout of this graph. The human age in years is shown here on the bottom x-axis. The canine age at time of diagnosis is shown in years at the top x-axis. And then on both of the y-axes, it's the number of cases over the total. So essentially the frequency of that age at diagnosis. The humans are shown in this black line here, and the dogs are shown in this dotted line here. And one big difference between humans and dogs with osteosarcoma, this isn't the focus of the talk, but that is that humans are diagnosed with osteosarcoma more commonly at a much younger age. But in dogs, we see a smaller peak at young age, and then we see a much larger peak at an older age. So usually around 8 to 10 years is when we see osteosarcoma most commonly. So it is a disease usually of older dogs. And then we also see osteosarcoma more commonly in large and giant breed dogs. It can occur in any breed or any age of dog, but it's by far more common in older, large, or giant breed dogs. And so when I say confounding variables, what I mean by that is that if you actually look at the populations in the liquid biopsy literature, oftentimes the dogs that are diagnosed with cancer on these liquid biopsy tests are older and they tend to be larger dogs. And so we don't necessarily know that the biomarkers that are being detected are specific to cancer. It could be that we are just identifying features in the blood samples that are associated with being older dogs or with being larger dogs. And this isn't necessarily a fault of the study. It's just the population that we're more likely to see these cancers in, but it's just something to keep in mind when you're interpreting the results of these tests. I'm now going to move on to a very brief review of diagnostic test accuracy. This might be a little painful for all of us. It's a little brief mini review of some statistics, but I think it's important for understanding and interpreting these tests correctly. So when we're evaluating a test, we have to consider the true disease state of the patient and also the results of the test. So that patient, its true disease state could be that it has the disease, or it could be healthy or free of the disease. In both of these populations, the diagnostic test result could return positive or negative. Positive meaning that it has the disease as judged by the test, and negative meaning that the test predicts that it's free of the disease. When we have a positive test result in a diseased patient, in a patient that truly has the disease, we consider that a true positive. However, if we get a positive test result in a patient that's actually free of disease, we consider that a false positive. A negative result in a patient that actually does have the disease is considered a false negative. And then a negative result in a patient that's free of disease is considered a true negative. And these values are used to calculate the test's sensitivity and the test's specificity. And it's important to know that in order to accurately determine sensitivity and specificity, we have to actually know what the true disease state is of the population being tested. Um, and these terms, sensitivity and specificity, are very easy to get hung up on, but I like to consider kind of what the common usage of these terms is. So a sensitive test, you consider like a smoke alarm. Smoke alarms are very sensitive. If a smoke alarm goes off, we know that it's very likely to go off whenever there's an actual true fire. But anyone who's left something in the oven too long knows that smoke alarms are likely to go off when there's not actually a fire, but just kind of a false alarm. And so that's a very sensitive test. A specific test is going to be more specific to the actual disease that you're interested in. And whether a test returns as either positive or negative really refers to the cutoff value for that particular test. And the cutoff value is typically determined by trying to maximize both the sensitivity and specificity. In a perfect world, a test would be both very, very sensitive and very, very specific, but that's often not possible. So we try to kind of maximize both of those. But it's important to keep in mind that a very, very sensitive test will likely catch all cases of the disease. But if that test is not also very specific, we're probably going to get some false positives too. Similarly, a very, very specific very specific test, we're more likely to be able to believe the negative tests, but it's possible that there's going to be some false negatives as well. So really trying to kind of maximize both of these conditions, but knowing that when we take one into account, we're probably going to lose some of the other one. And then I saw this kind of mnemonic for remembering what the best use of these tests are. And so I thought this was kind of helpful that a very, very sensitive test is best used for a screening test. And this is because, again, a sensitive test is likely to catch all cases of the disease, but it's possible that there are going to be some false positives as well. So it's best used for screening. And then it's better to follow that up with a very specific test as your confirmatory test. So making sure that we don't have some false positives from that general screening population. And why this is important is if you actually look at some of the tests for liquid biopsies that are on the market, a lot of them do pretty well as far as specificity, but they're actually not as high in the sensitivity department. And so they maybe aren't the best for use as a general screening tool, at least at this stage. So again, just good things to keep in mind when considering the use of these tests. Okay, that's all the statistics. I'm going to move on now to some more considerations. So when a liquid biopsy test is positive, the next question is going to be, what now? Of course, now we're worried that this patient might have, or patient or pet might have cancer. And so what do we do next? And so in general, I like to think of kind of the progression through the diagnosis with these steps. So it starts out with some sort of risk factor. And then we do our screening test. Again, this is ideally a test that's very sensitive. And if we return a positive on that screening test, then it's best to follow that up with a more specific test to confirm our suspicion. And so after a liquid biopsy test, the next logical thing to do if that returns positive is to consider doing some diagnostic imaging. So that could be X-rays or ultrasound or even something like a CT scan. And so after that, if we find something on that imaging, then it's best to follow that up with the most specific test that can be done, which is usually the diagnostic test and often is something like a tissue biopsy. So I point this out to just show that we're not really relying only on the liquid biopsy test. We're just using it as part of this general diagnostic process. So, to use an example that's not a medical example, but I thought kind of illustrates that kind of progression pretty well, is let's say our risk factor is a house, and maybe it's an older house with maybe not the most up-to-date electrical wiring. And we have that smoke detector that's used to just, for a safety measure in case there's any sort of fire or anything like that. If that screening test starts returning a positive result, we're going to have a firefighter come check out the house, make sure everything's okay. That's our diagnostic imaging. And then if we find something there, maybe we're getting an electrician to come out and check the house out, and that would be our diagnostic test, which would be our biopsy. So just kind of showing that we're getting more and more specific as we go through. An example from human medicine would be if we have a risk factor that's either current or previous use of cigarettes, then that person's at an increased risk for certain cancers, in particular lung cancer. We may follow that up with something called a breath test, which is a test that's sometimes used in human medicine to assess risk of developing lung cancer. If that test returns positive, the next step would be a CT of the lungs to look for any sort of tumor. And then if we find anything on CT, then that person would be recommended to have a biopsy. So it'd be a similar progression of things through in veterinary medicine as well. Now, since I mentioned that a liquid biopsy test that returns positive, the next step would probably be doing diagnostic imaging, so doing some sort of x-rays or ultrasound or CT. I think it's important to go through each of the different scenarios, and each of them do have some consequences. So let's say our liquid biopsy test is positive and our imaging is positive, or our liquid biopsy is positive, but our imaging doesn't find anything. And then what happens if our liquid biopsy is negative, but there actually is a tumor there, versus if our liquid biopsy is negative and there is no tumor? So I'll be going through each of these scenarios and kind of what the consequences are. I will be mentioning the potential for euthanasia in here, which I know is a difficult topic to talk about. But I think it's important to keep these things in mind, because any test that we develop, and this is where all of my research is, but these tests that are developed, they actually do have real consequences, because the families that are going to be receiving these results are of course going to have questions and have anxiety about what these results mean. So let's say we get a liquid biopsy test that's positive, we do imaging and we find something. If that's a tumor, then the next logical step would be doing a surgery or some sort of biopsy to find out what that tumor is. But sometimes we do imaging and we find things that we don't know if they're actually causing any sort of problem or if they're incidental. So this could be potentially a small nodule in the liver, sometimes a little nodule on the adrenal gland. We don't know if that's causing any sort of disease. We don't necessarily know if that's what caused the liquid biopsy test to be positive. So it leaves us with kind of a conundrum of what to do with these incidental findings. Do we then recommend surgery, which of course has risks to it? And is there the potential for euthanasia because we did a test that was positive and now we found something? If surgery is not necessarily in the best interest of that patient, is that going to be something that maybe makes that family consider euthanasia? Now, let's say we have a positive result and then we do our screening imaging, but we don't find anything. How far do you have to go with imaging to truly consider that negative? Is doing x-rays enough, or do we have to do x-rays and ultrasound, or do we have to do a full body CT scan? How far do we have to do this testing to know that maybe it was a false positive liquid biopsy test? How often do we need to repeat? So just because the imaging was negative one time, does that mean that there truly is no tumor, or does that mean that it's maybe too small to find on our imaging tests? And we don't really know, there's not a lot of evidence to say how often imaging should be done in these situations to know that it's truly a negative finding. Of course, all of this time, there's an increase in fear and anxiety for the family who has this positive liquid biopsy test suggesting that there's potentially cancer in their beloved pet, but then the imaging doesn't find anything. So it almost feels like the pet has this ticking time bomb, which causes a lot of anxiety. And then there's the potential for euthanasia here too. Hopefully, not just based on the results of a positive test in an otherwise acting healthy animal, but let's say then the animal is diagnosed with something that's very treatable but expensive. Now they have this treatable disease, but they have this concerning liquid biopsy test. Is that family going to be as willing to treat this treatable disease knowing that there's maybe cancer somewhere? So again, it's just something to keep in mind because there's a lot of consequences to each of these situations. Now, let's say our liquid biopsy test is negative, so that would indicate that there's not an increased risk of cancer based on that particular test. But maybe there actually is a tumor in that patient because this test is not 100% sensitive. Are the other diagnostics that should be done to diagnose that tumor, are they going to be delayed because we have this false sense of security because the results of the liquid biopsy test were negative? Are we going to ignore or downplay these clinical signs because, again, we have this negative liquid biopsy test that's probably not cancer in our minds? Um, and so it makes me worry that potentially we're delaying getting an actual diagnosis based on some of these tests. And then let's say the results of a liquid biopsy test were negative and there actually is no tumor in the patient, which this is, of course, the best case scenario. But how often do we need to repeat the liquid biopsy test? And is this actually supported by data? I think all of us would love for these tests to be something that can be incorporated into the annual appointments for our pets so that if we do have cancer, that we can diagnose it earlier when it's potentially more treatable, but we don't really know how often we need to be doing these tests and how long a negative result lasts. And we also don't know how accurate these tests are at assessing risk of future cancer development. So just because it's negative today, does that mean that it's going to be negative down the road? Um, Again, some tough concepts, but I think it's important because there's a lot of excitement over the use of these tests, but there's not always a lot of thought about kind of what the consequences can be on an individual level. So I'm going to move on a little bit to talk about some applications of liquid biopsies here. So this figure is a figure that's modified from a human paper, but it talks about the different areas where liquid biopsy tests might have use. We talk about them a lot in this step number 2, which is early detection of cancer, because that's really where kind of the field has been trying to find a way to diagnose cancers earlier so that they are potentially more treatable. But there are other applications too. So first being risk assessment. So this would be an animal that's healthy and does not have any cancer in them, but the liquid biopsy test would be used to determine that animal's risk of future cancer development. So this would be something like looking for a mutation in the DNA that would put them at an increased risk of a certain cancer, kind of like a BRCA mutation in humans that was associated with increased risk of certain cancers like breast cancer. And so this is something that we can definitely use. It's being investigated in veterinary medicine as well. Early detection, as I mentioned, is when the animal does have cancer developing, but it's not yet to the point that it's detectable through more standard methods or that it's showing significant clinical signs, with the goal of diagnosing the cancer earlier so that there are potentially more treatment options and hopefully a better prognosis. Um, 3 is guiding therapy. So this would be looking for specific mutations in the cancer that guide the clinician or the owners to select one therapy over the other. There's not a lot of evidence for the use of this in veterinary medicine yet in the liquid biopsy sense. There is some evidence for guiding therapy with tissue biopsies where we can look for specific mutations in the tumor to help us select one treatment over another. But in the future, this could be something that maybe liquid biopsies could be helpful for as well. And then the fourth area here is disease monitoring. And so this would be something like we have a patient that was diagnosed with cancer. They were treated, be that with surgery or chemotherapy or whatever the best treatment for that cancer is. And we can actually use the liquid biopsy tests to see did the analyte that we're measuring go down after therapy? And then as time goes on, do we start to see that analyte rise again, indicating that potentially the cancer is back, with the goal of catching recurrence of disease sooner, again, when there might be a better chance of getting it under control. So all of these have potential uses both in human medicine with liquid biopsies and in veterinary medicine. Um, of course, just like we've been talking about, there are pros and cons. And I'd like to just mention a few of them here. So a few of the benefits of using liquid biopsies in any of these senses. are that we can, if we have a positive result, we can hopefully introduce either appropriate surveillance or diagnostics to try and find things earlier. So even in a healthy animal that is determined to be at an increased risk of developing cancer, maybe that would trigger us to recommend more screening tests like imaging more often, even while the animal's healthy. Actionability, of course, if we have an early diagnosis, then we can hopefully treat earlier or maybe even prevent it. And then there is, of course, that idea that finding cancer earlier improves the outcome, which is the goal, of course. And then with targetable mutations, if those are found, there's the potential for a more personalized therapy that's individualized to that particular patient and their particular disease. The cons are that risk of cancer development does not always mean that that cancer will develop or any disease. If an animal has a particular mutation, some of those animals may never develop that disease. And on the flip side of that, if they're determined to be low risk, that doesn't mean no risk. And so we have to keep in mind that even a negative result could, that animal could still develop that disease. Is the result actionable? So sometimes there are actually no steps that can be taken to prevent or treat early. And so having a positive test doesn't necessarily mean that we can change how we treat. Are there even any other treatment options? And are those treatment options investigated in animals? And are they safe to use in animals? There's unfortunately not as much evidence as one would think that early detection of cancers or other diseases actually improves the outcome. Logically, it makes sense that it should, but there's not necessarily always the evidence to back that up. And when we get a positive result, that can lead to screening and even potentially therapy that may or may not be necessary for that particular individual, and associated morbidity that comes with that treatment and anxiety for the family. And then if we get a negative result, we don't have evidence to tell us how often we need to repeat these tests in any of those settings. So I'd like to use an example from human medicine to show that sometimes early detection does not have the benefit that we necessarily want it to have. And so using PSA testing, which is prostate-specific antigen testing, when this first came out, it was, very exciting because it was a way that we could use a non-invasive test to diagnose prostate cancer earlier. However, a very, very large, with thousands and thousands of cases, study actually randomized men in the age range of 55 to 69 years. These were men that were enrolled in Europe, and they were randomized to either have screening done with the PSA test versus not to have screening done. And again, with the goal of hopefully diagnosing it earlier, leading to better outcomes. And over a long period of time, with many cases, they found that using only PSA testing as a screening test in order to prevent one individual from dying from prostate cancer, they had to screen 1,000 men and detect and treat 37 cases of prostate cancer. And of course, it's great that they were able to prevent any deaths from prostate cancer. And that's obviously the goal. But for the other 36 cases that were diagnosed and treated where it did not actually have an effect on their overall outcome, there was significant morbidity found that was associated with anxiety of having a cancer diagnosis, the time, the treatment, cost of treatment, and then of course the side effects. And there were even some cases of mortality that was treatment related, not cancer related. And so this kind of led to a shift in how this test is used, where it's no longer used as the sole method of screening in this age bracket, but rather it's used in combination with other things like familial risk and surveys as kind of part of the overall way of screening for this cancer. So I thought this really kind of uses this example to show that sometimes early detection can be associated with side effects as well. And then I'd like to introduce this concept as well. This one's relatively new to me, and it's something called lead time bias. And so using this example here, so cancer was diagnosed here, and then this is kind of the timeline. After the cancer, sorry, not diagnosed, when the cancer first was initiated, um, it's some period of time before the cancer is actually detected because symptoms had to develop and then diagnosis had to be performed. And then after the time of cancer detection, this is the amount of time until the patient passed away from the cancer. And so this is the perceived survival time of that patient. So let's say that they were diagnosed and they lived 6 years with that cancer. But if we have a early detection test or screening test, they might be diagnosed with that cancer earlier. They may or may not have any sort of benefit as far as survival time. Let's say they die at the exact same time they were going to. It artificially looks like they had a longer survival time. And so it's something to keep in mind with a lot of these early detection test studies that they may show an increase in survival time that may or may not be present because of this lead time bias. Just diagnosing it earlier, let's say now there's 10 years between the time of diagnosis and death, where there's no actual difference in survival time, but it just appears as though there is. And so this is a bias that can be present in some of the studies looking at early detection. So I'm going to move on now, excuse me, to talk about some of the liquid biopsy tests that are either currently or were recently in use in veterinary medicine. There are just a couple, and specifically talking about cancer early diagnosis liquid biopsy tests. So the first one is this test called Nu-Q. This one is looking at the release of proteins that are supposed to be in a cell's nucleus, but are released into the blood. And the thought here is that these nucleosomes are more likely to be in the blood when there's cancer because of the increased turnover of cells as cells are dying and being created and everything. So having higher levels of these nucleosomes was found to be associated with an increased incidence of cancer. However, some limitations of this test are that there are a lot of other things that can cause nucleosomes to rise in the blood. If the sample is performed on a patient that wasn't properly fasted, so if they've eaten in a period of time before the sample was drawn, that can actually cause a false increase in the levels of nucleosomes and make it look like there's cancer when it's not actually there. Similarly, any sort of inflammatory condition can increase these levels as well. And so there's also some issues with this sensitivity of the test where lots of patients with cancer can actually um, have a negative result too. So issues with both sensitivity and specificity there, but this is a test that's currently on the market. There's this other test, which is kind of an interesting methodology to this test. This one's called Oncotect, and it's a test where a sample from a dog is actually placed on a little dish, and these very small nematode worms are placed in the dish. And the thought there is that these worms are actually, they can sense cancer, and then they're more likely to gravitate towards the sample if there's cancer present, and away from the sample if there's not cancer present. And similar technology has been used in the human field for a while, and there have been some issues with reproducibility, and again, both kind of issues with sensitivity and specificity there. And then this test was available, this OncoK9 from PetDx. This test had been available for the last couple of years, and there were lots of publications evaluating the use of this test. And it was looking at cell-free DNA as a method of cancer detection, both quantitatively, so the amount of cell-free DNA, and then also different mutations present within the DNA. And had some early promising results. Unfortunately, they are not still accepting samples, and I am not sure what exactly the future of this test is. There were some issues also with transparency where it wasn't exactly clear what was causing them to um, consider a test positive versus negative. So it's no longer on the market, but may or may not be in the future. So those are really the big three tests that have been either available recently or currently still available. And unfortunately, I don't think any of them are ready for broad application to our pets quite yet. But of course, that is the goal, is to hopefully have a test at some point that we can use to try and diagnose cancer earlier. We're just not quite there yet. So in summary of that section, these tests are not quite ready for use in all of our pets. There are false positives and false negatives. There can be false, um, and these can be occurring with other diseases or with issues with kind of test reproducibility. So certainly at least two of these tests are still available, and you can consider using them, but I would recommend discussing this with your veterinarian. And then, of course, keep in mind that liquid biopsy test, just like any other diagnostic test, needs to be actionable. So consider before you do a test like this, how is that going to change how you proceed with your pet? So, just finishing up with some ongoing work that we're doing here at the University of Minnesota. I'll talk about 4 projects just very briefly. The first one is COED. This is our canine osteosarcoma early detection test. This is one of my projects where we are getting blood samples and we're looking at the contents of exosomes. These are those little packages in the blood, and we're using the contents of these exosomes to stratify patients into those that we consider to be at an increased risk of osteosarcoma development versus a low risk of osteosarcoma development. So this is one ongoing project. The next one I'll mention is Shine On. This is a project that's being led by one of my colleagues, Dr. Jaime Modiano, and it's a flow cytometry-based test looking to identify risk of many different cancers. Next one is also a test of Dr. Modiano's and other colleagues called LYRA, which is looking at levels of cell-free DNA and determining risk of lymphoma development. And then the final one is a pediatric osteosarcoma project of mine that we're calling KidsCan. And this is a test that we're developing in kids that already have a diagnosis of osteosarcoma. And we're looking for features contained within exosomes that can be predictive of prognosis in pediatric osteosarcoma. So I'd like to end with just some final thoughts. It's important to remember that age is not a disease, not in humans nor in our pets, and neither is the breed. So it's, try not to get hung up on age and breed of dogs when considering cancer risk. And our ultimate goal is to reduce the impact of disease on our companion animals. Obviously, these are beloved members of our family, and so we want to try and reduce the impact of diseases on them. And our goal is to one day have a test that we can use to predict cancer risk and act upon that risk. But at this point, I don't think these tests are quite ready for broad application yet. So that's why I wanted to talk about this with all of you and kind of introduce these concepts because it can be very easy to see these tests being marketed, and it is very exciting. We just have to be very rational about our use of these tests and realize that they're not for every family, not for every pet quite yet. So returning back to my take-home messages, hopefully after our time together tonight, we've talked about how liquid biopsies are an evolutionary step in medicine, and this is where the field is going to try and really develop these non-invasive tests that can individualize therapy for both humans and our pets. But at this point, we should not use these tests indiscriminately. We all need to interpret the data carefully and remember that a liquid biopsy test, just like any of our tests, should be actionable. With that, I'd like to thank all of you for your attention and for attending this tonight. I'd like to thank my team and collaborators, the agencies and the donors that have provided financial support so that we can work on developing these tests. I'd like to thank the dogs and their families who enroll in all of our studies, both mine and the ones that our colleagues here at the university are doing. And of course, all the people that came before us to enable the exciting work that got us here. And with that, I'd be very happy to try to answer any of your questions.
Thank you, Kelly. Thanks so much for that great presentation. So we'll move into the Q&A portion of the evening now, and we'll start with the pre-submitted questions we got when people registered. So this is sort of a process or point in the process question. At what point would liquid biopsy tests be recommended for an animal? Can these be used to scan for cancer or a disease when no current symptoms are present? Can these tests be part of overall blood tests and screening?
That's a great question, and that is absolutely the goal that we are all working toward is to find that test that can diagnose cancer or really any disease before the symptoms have started. I don't think we're there yet. I think the best use of these tests currently is if you have a patient where you suspect there might be a cancer, but it's in a place where it would be really hard or dangerous to get a sample of that cancer. So it could be kind of another piece of the puzzle.
That's really good to know. Thank you. We have a question here about what can be expected in terms of the range of cost to do this. Would this be part of comprehensive well annual checks when appropriate? Or like you said, are these only when there's something suspected? So asking about the range of cost.
Yeah, so our goal would be for it to be something that is feasible for the average family to do for their pet as part of their annual screening. Um, Again, I don't know that we're there yet. The new Q test, I think, is relatively reasonable, but at this point, because of the false positives and negatives, I don't know that it's even at a reasonable cost point. I don't know that it's something to consider in every patient yet. All the way up to the Onco Canine test was, I think, $1,000, but that one's no longer available. Our research-based tests, we don't have a price point for them yet because they're not quite at that level of clinical use. But our goal is to find something that could be reasonably cost at, something that could be added on to the screening for our pets.
Awesome. Thank you. You touched on this in your talk, but asking for a little clarification or a bit more detail about what potential cancer signs would make a pet owner want to seek a liquid biopsy. Um, so wondering about what potential cancer diagnoses or signs would make for liquid biopsy to be a good option.
Great question, but also a tricky question. So, the tough thing about cancer is that it can present in many different ways depending on what organ is affected and um, how significant the lesion is. So it's really tricky to find that one sign that would trigger me to say we should do a test like this quite yet. But some of the common things that we can see are weight loss despite a pretty good appetite. So they're eating relatively normally but losing weight. They are lethargic. Um, Things like that would trigger me to want to do some testing to figure out what's going on. But there's a lot of overlap between those symptoms that could be with cancer and other chronic diseases. So we could see similar signs with kidney disease, gastrointestinal disease. So really, I think it's something that every concern that you have should probably be discussed with your vet. And certainly, if they have questions about the use of these tests that are out there, they're welcome to consult with us here at the university as well.
Great, thank you. We have a question here asking, um, there are companies coming onto the market making claims about blood detection of cancers. What questions should be asked of all of these companies to look for the concerns that you have described today?
That's a great question. I think the best way um, to figure out some of these kind of issues is to actually look at the primary data, which is a little tricky. But looking at the paper and looking at what was the sensitivity, what was the specificity, what population did they use to evaluate these tests, and then discussing that with your vet to see if it's something that maybe could be applied to your pet. But a lot of times the marketing, of course, focuses on the positive results. So it's just something that it's not a bad thing, but something to keep in mind.
Thanks. All right, we have some others coming in here. A couple people are asking about the particular cancer, hemangiosarcoma. Um, is there anything that you can speak to about the efficacy of liquid biopsies in that space?
So one of the tests that one of my colleagues is developing, the Shine On test, that really was started as a hemangiosarcoma detection test. It does seem to be kind of more predictive of just cancer in general, but I think it is a very common cancer, and it's a cancer that we know once it's diagnosed, it's often in the later stages. So I think that's one that really is on a lot of people's minds. That would be a great one to have a good diagnostic for, but there's nothing on the market quite yet that would be for clinical use to help us diagnose that.
Sounds good. Thank you. Next, we have a question. Um, the way it's phrased is a liquid biopsy more beneficial for larger dogs or smaller dogs when factoring complete pro-con factors?
Oh, that's a good question. The goal would be to have it not really matter the size of the dog. But I do know that some of the things that we're measuring, the more blood that you have available to analyze, the more likely you are to detect some of those things. Like some of the mutations, are pretty rare that, for example, cell-free DNA tests are looking at. And so for that reason, it might be that you're able to get more blood safely from a larger breed dog than a smaller breed dog. But in general, that's the only kind of connection to dog size that I can think of. And that's a little tricky too, because we do know that cancers in general and some specific cancers are a little bit more common in some larger breed dogs.
Sounds good. So we're at the last section of our questions here. Wrapping up with just a particular disease questions other than cancer. Someone was curious about the role in detecting kidney disease and as well as insulinoma and the pancreas. So just in those realms, if you could speak to that.
Yeah, great questions. So with kidney disease, some of these cancer diagnostics probably are not going to be terribly beneficial. But really our serum chemistry profile can be somewhat considered a liquid biopsy test for kidney disease because we look at BUN and creatinine, which are two markers of kidney function. There's also a test that came out maybe 10 years ago called SDMA that can detect kidney disease or decrease kidney function at a somewhat earlier stage than creatinine. And I think now that the SDMA test is kind of more being more used, we're left with some questions about, okay, well, how does that affect how we proceed? If we have an SDMA level that's elevated, but the BUN and creatinine are normal, do we potentially change how we're proceeding? And I think the best thing that it really tells us is that maybe we might want to, if the pet is on any sort of medications that have potentially kidney toxic side effects, like non-steroidal anti-inflammatories, maybe we would want to use those a little bit more cautiously or not at all. But that's really the best way that that test can help us right now. But that could change in the future as we get more and more evidence about it. Insulinoma, I would say the best test for that is evaluating the blood glucose level in combination with the insulin level. And in a way, that's kind of a very specific liquid biopsy type test for insulinoma. It's possible that some of the other liquid biopsy tests that are looking at multiple cancers may have a role in detecting that, but whether that would be sooner than the kind of standard method of glucose and insulin levels, I'm not sure yet.
Actually, Kelly, right before you finish, we got one more question, and I think we
Great.
have time for this one more. Would these tests have any efficacy in detecting recurring disease? In an example where a dog had osteosarcoma that had been eradicated through surgery, radiation, and chemo, could these tests be used down the road to see if that disease has come back?
That's a great question. And that's actually kind of what started my work in this realm is that we did identify a gene signature in dogs that had osteosarcoma and were treated for it. And if they still express that gene signature after therapy, it was associated with a worse prognosis. So we suspect that that's due to there still being residual disease after therapy. That test too was in a small population of dogs, so it's not quite ready for prime time, and I don't know that it would change how we treat an animal that was already treated and appears to be clinically in remission. But it did kind of inspire us to start investigating these biomarkers in osteosarcoma, and I think there is more evidence in the human side of things that they call them minimal residual disease tests have a role. So I do think that's somewhere where the field is heading, to use kind of these biomarker tests for monitoring response to therapy. And if we see recurrence, then potentially either initiating therapy again or changing it. But great question.